our shot at getting Ohio vaccinated.
But I'm hoping that we can get back to, bit by bit, some sense of normalcy.
One by one, Ohioans are rolling up their sleeves to join the fight against coronavirus.
This is gold. This is saving people's lives, and we can't get it fast enough.
This final battle won't be quick.
I never imagined we'd be this far into the year still in dealing with this, actually.
Or easy.
I just kept running into brick walls.
But it does put us on a path toward a safer future for all of us.
This vaccine just isn't for me, it's for other people. It's for the public, it's for my family.
It's hard to believe it's only been a year since the first coronavirus cases were confirmed here in the U.S.
Weeks later, the pandemic made its way to Ohio. Now we have our shot at getting back to the things we miss. Tonight, we take a closer look at Ohio's vaccination rollout, from navigating the system to what it means for those at the end of the line, all the while getting your questions answered live.
Ohioans have already received about 1 million doses of the coronavirus vaccine, but that's just the start. And even as more Ohioans qualify to get their vaccines this week, there are still questions and confusion.
Sure is. 5 on your side. Chief Investigator Ron Regan begins our in-depth look at Ohio's vaccine rollout tonight. Ron, you went straight to the governor for those answers.
Well, Governor DeWine agreed to a one-on-one interview to answer questions about the vaccine rollout. We begin tonight with the supply.
We don't have enough vaccine.
Governor DeWine says the nationwide shortage of vaccine is the biggest challenge. 77-year-old Julia Varley is waiting to hear when she will get her second shot.
I've talked to a lot of seniors who are very frustrated.
We have a shortage. There is a shortage.
Well, there's a nationwide shortage, and it's a huge problem. I sometimes kind of laugh when I listen to other states and they say, well, we ran out. Well, yeah, I mean, we run out every week.
According to figures we found at the Centers for Disease Control that tracks vaccinations, more than 954,000 doses have been administered in Ohio. Yet another tracker compiled by Bloomberg reveals just 7% of Ohioans have received at least one dose, appearing to trail neighboring states. Michigan, 7.7%, Indiana, over 8%, and West Virginia, nearly 11%. Why is Ohio not doing as well as some surrounding states?
Well, I'm not sure that's true. I mean, it depends on how you look at it.
Why? It's a snapshot in time, delays in updating, plus thousands of doses are required to be held aside for nursing homes. Health officials caution all three impact statistics.
Let me tell you something that we take great pride in. We have really tried to drill down on who is the most vulnerable.
So we asked the governor about that plan, starting with putting nursing homes first.
54% of all the deaths in Ohio have occurred from people who are in nursing homes. So we know that if we could get people vaccinated in nursing homes, and we have well over 900 nursing homes in the state, we would be going a long way to save a lot of lives.
Thousands of vaccination sites across the state instead of centralized locations. Does that make it just harder to get the vaccine out to all these different sites?
We made the decision to try to go to where people live.
And whether it's working efficiently. Are you convinced that it's getting out to those who need it as quickly as possible?
Yes, we looked at this last Sunday. We had 98% of what we had received were already in people's arms for the first doses.
Finally, confusion over scheduling.
We hope within the next several weeks to have a more central scheduling place. So if you could go online in one portal, and then that would take you to your county and it would show you the places you could go. And then you could go in and make a reservation directly on that portal.
For Julia, she blames the federal government for the lack of supply and slow rollout.
I think further up in the government, if we have done a poor job of getting the vaccinations out to states.
And the governor believes it was best to start with healthcare workers and those over 65 that account for 87% of all COVID-related deaths. I'm Chief Investigator Ron Regan.
Our thanks to you, Ron. We appreciate it. And we've heard from many of you about the COVID vaccine confusion. How do I get it? Who has it? When is it my turn? Governor DeWine says the state is working on a one-stop portal where Ohioans can sign up to get the vaccine. But until that happens, 5 on Your Side investigator Jonathan Walsh shows us 3 things you can do to get your vaccines.
We don't have enough information.
74-year-old Norman Maxwell from Cleveland says he experienced a confusing COVID situation at the VA hospital recently.
I didn't see any signs that said we're giving out shots.
But he says he did see a line of people waiting for their shots. He said a VA employee told him to contact his doctor and then it would be 3 weeks until he got his shot. But that's not what the vets in line said to him.
One told me specifically, he said, I just got my shot. I said, well, when did you make the appointment? He said, well, I just came in today and I got it.
I just kept running into brick walls.
64-year-old Linda Armstead from Shaker Heights says she's tried to get on vaccine lists through many outlets, including some retail locations.
Their site said they didn't have any vaccines at the time and they weren't administering any.
Here at the Cuyahoga County Fairgrounds, the Board of Health was giving out shots.
We understand it's frustrating for people and it's a slow process to begin with.
Communications Officer Kevin Brennan has 3 tips for you to get your shots. 1, use the county's vaccine website.
And that will give you information about if, first of all, you are eligible. And then if you are eligible, you can sign up to be notified when we have clinics such as the one we're having today.
We check the site, put in an address, and it maps out various locations to contact for vaccines. Number 2, the Board of Health has a partnership with the Western Reserve Area Agency on Aging.
So if you contact that agency, they will connect you with an operator who will assist you with the registration process.
3, call 211 for assistance.
The community has been very responsive to trying to help seniors navigate the landscape.
And even a 4th suggestion. Kevin says contact your physician.
Some primary doctors are providing vaccine based on their affiliation with a particular health system.
It's all a coordinated effort to get you into these lines sooner than later. But as we've been talking about over and over again, one of the sticking points is the supply. And here it is for now.
We're ready to do more, and I think maybe other providers are as well, but the vaccine is just not available.
For those in line,
to have that peace of mind that I'm better protected against COVID.
But others are waiting, like Linda, who has multiple sclerosis, who says she should be getting her shot, and who wants you to know about her experience.
The reason I contacted you is to make people aware of what is going on out here in the real world.
I'm 5 on Your Side investigator Jonathan Walsh.
Okay, we have talked about how people at high risk can be vaccinated, but what about the rest of us? If you're at the end of the line, you might be wondering, when is it my turn? 5 on Your Side investigator Sarah Buttison has been digging into how long that will take and what life will be like while you wait for that shot.
If you're young and healthy, experts say you're going to need to be something else for the rest of the pandemic. Patient. Austin Reese can work from home.
It's been all from here.
He's healthy and 25, so he knows he will be among the last group of Americans to get the COVID vaccine.
I don't really mind it. I would rather people who need it get it first.
What will 2021 look like for those at the end of the line? We asked 2 experts, Dr. Shanina Knighton, a nurse scientist and infection preventionist, and Cuyahoga County Health Commissioner Terry Allen. First, spring.
I think in the spring, in the near term, we still need to be protective.
They say the risk of catching COVID will remain high.
I think that there's sometimes a false sense of security that just because we have vaccines available, that COVID's just automatically going to go away.
It won't. Keep up prevention practices like social distancing, wearing a mask, and avoiding crowds.
It's not the time to abandon them. We've made it this far. Let's continue on through the spring here.
Summer is when life will look more normal.
The question is really what's normal?
It will be safer to be social, especially outdoors, but remain vigilant about washing your hands, wiping surfaces, and wearing your mask when needed.
Infection prevention practices, or what I know in terms of infection prevention practices, these are things that we should be doing anyway.
It's too soon to say whether going to large gatherings like concerts or weddings will be a good idea.
I think we have to wait and see what the lay of the land is come summer.
Finally, fall.
I think come fall, it is our hope that we'll start to really break into that general population.
Vaccinations should be more widely available. They say when it's your turn, take your shot.
You know, you're not invincible. And by you getting vaccinated, you also are protecting all the people around you.
So what about someone like Austin?
It kind of stinks that the world's a little bit different.
When can people at the very end of the line expect to get vaccinated?
We're still looking at about 2021 going into 2022. Yeah, so we're quite a bit of ways away.
Oh, wow. For the vaccine. Oh, wow.
He spent most of the pandemic in his downtown Cleveland apartment.
I'll just have to continue that and, just hope that there's an end to it sooner than later, Just be hopeful about it, I guess. It's the only thing you can really do.
In Cleveland, I'm 5 on Your Side investigator Sarah Buttison.
I miss a lot of things. I miss traveling. I miss the camaraderie, being able to be within 6 feet of one another.
We have not gone to a grocery store in almost a year.
Getting Ohio vaccinated. It's our shot at getting back to the life we used to know.
It was the beginning of the end.
What it's like for those who've had their vaccine as Ohio schools get ready to vaccinate their staff to get kids back in class.
The virus controls the timeline.
So today kicks off Ohio's push to get students back into the classroom by March 1st.
And that means sending COVID-19 vaccines to certain counties across the state specifically for school staff. News 5's Kevin Berry shows us how the first districts are getting ready and the rest are standing by.
I miss a lot of things. I miss traveling. I miss the camaraderie, being able to be within 6 feet of one another.
We have not gone to a grocery store in almost a year.
Getting Ohio vaccinated. It's our shot at getting back to the life we used to know.
It was the beginning of the end.
What it's like for those who've had their vaccine as Ohio schools get ready to vaccinate their staff to get kids back in class.
The virus controls the timeline.
And now that people are getting vaccinated, how does life change? Or does it? Our Homa Bash gives us a closer look. Hey, Homa.
Hey, Courtney, we spoke to 5 different people in 5 very different stages of life and career who have now gotten both their vaccine doses. There's one thing they're all desperately looking forward to and one thing they really want to remind all of us about.
I think December 28th.
The second one was January 7th.
I had it last Tuesday, the 19th.
Second dose last Wednesday.
We'll start with the Basnicks, Donna and Dick.
We have not gone to a grocery store in almost a year.
They're 78 and 75 years old, live at the Kendall Retirement Community in Oberlin. It's been nearly a year of isolation and staying in their bubble, seeing their daughter Becky from afar. Donna knows the value of vaccines. She had polio as a child.
I remember as a kid when I got my second polio vaccine, I remember her crying and just being so grateful that we were protected.
But now, fully vaccinated, the Basnicks see that end in sight as they wait for their family to get their shot.
But we have our master list for when it's the whole family again.
And at the very top of that list, of course,
hugs. Hugs.
But I miss the hugs from Mom and Grandma and everyone else.
Yep, hugs is what Dr. Marcus Germany is looking forward to most, too.
The first one's going to be really sweet.
He's a resident physician at Metro Health Medical Center. For 10 months, he's seen firsthand how much COVID can ravage the body. Grateful for the vaccine, but still really careful.
It's great, but I still want to, take it with a grain of salt and be very cautious that things can still get bad despite the vaccine, because nothing's 100% effective.
The vaccine it's 95% effective. So there is still that small chance.
Jennifer Lobeck, a registered nurse in the medical ICU at Fairview Hospital. Coronavirus consuming her life since March 13th, 2020.
There hasn't been a day where we haven't had one COVID patient.
The vaccine gives her a chance to finally be with the nephews she hasn't seen in a year.
This vaccine just isn't for me. It's for other people. It's for the public. It's for my family. And I'm going to get tearful because I haven't seen them. I haven't hugged them.
We have one extra layer of protection.
That's Dr. Crystal Tomei, a pediatric neurosurgeon at Rainbow Babies and Children's. 2 doses done, and for her, that is no small feat. I hear you're terrified of needles.
I am so phobic of needles.
Not when they're pointed Away from her, though, she's volunteered to give caregivers their shots during her free time. But even vaccinated, Dr. Tomei says for now, nothing in her life will change.
I think we're all hopeful that the vaccine will make it less easy for us to transmit COVID if we get it. But right now, all that we know for certain is that people who are vaccinated don't get as sick. I'm still going to wear my mask. I'm still going to be socially distanced. I'm still going to make sure that I'm washing my hands.
It'd be irresponsible to do all this work, get the vaccine, and then go crazy. Just strip everything away.
For these folks and for so many others, the COVID vaccine has meant hope and excitement with a heavy dose of caution.
It was the beginning of the end.
Definitely. It is a sigh of relief.
Relieved.
It's a relief, but it's a first step towards getting everybody so we can be together again.
Because through all the sickness and the shots, together again, safely, that's all we really want.
And we know you have a lot of questions about the coronavirus vaccine. I have a lot of questions about the vaccine. So we've lined up a team of experts ready to try to answer them. I'm hosting a discussion happening live on our Facebook page in just minutes. Log on, join the conversation, get your questions answered. Rob, Courtney.
Good stuff, Homa. Thank you. Now, this is the beginning of the end, but still it's a long way to go until enough Ohioans are vaccinated against the virus.
So until then, we'll continue to wear our mask, wash our hands, and keep our distance. That's it for our shot, Getting Ohio Vaccinated.
Oh, we're not done yet. We haven't forgotten about that all-important Power of 5 weather forecast. Mark is up next. Well, now we get back to News 5's Kevin Barry. He's going to show us how the first districts are getting ready and the rest are still standing by.
In Angela Reve's Parma home, she was sure a few weeks of remote instruction early last year would be enough to fend off COVID.
I never imagined we'd be this far into the year still in dealing with this, actually.
She and everybody else was wrong. Her high schoolers have bounced back and forth between hybrid schedules and being fully remote since last March.
Because no matter how well the teachers are doing and how hard the students are working, there's just always a component missing.
That's why Governor Mike DeWine is pushing teachers to the front of the line this week to get COVID vaccines, leaning on school districts to return to in-person learning by March 1st.
The virus controls the timeline.
Parma City School Superintendent Dr. Charles Smilak says the goal for him is to be open as soon as possible, but March 1st still might be too early.
Despite the fact we'll have our staff vaccinated, do our families feel safe sending their children to school? That's another variable.
He says Parma is doing hybrid instruction right now, and the earliest that could change is April. Cleveland school CEO Eric Gordon isn't committing to a date either, but he has a plan to vaccinate 12,000 school staff in a week with large vaccination sites at CMSD high schools.
So you're going to see us making a good faith effort. You're going to see us preparing for opening, but we're not going to do so until we can guarantee the safety of our faculty and therefore the care and safety of our students and community.
And while Cuyahoga County waits, Medina and Summit counties are 2 of the first 10 communities in Ohio to get the vaccine shot this week.
And we're going to cover all schools within one day, and that's going to be Thursday, February 4th.
Discount Drug Mart's Jason Briscoe is in charge of vaccinating all of Medina County's school staff using 2 high school gymnasiums. Governor DeWine's office told me in the past they've avoided mass vaccination sites for the general public. Even though CMSD and Medina County are using large locations to vaccinate a lot of people, the governor's office tells me it doesn't consider these plans to be mass vaccine sites, saying that these locations will use scheduling to make sure that there aren't large groups of people standing around for a shot.
I believe, Kevin, is just a numbers game in trying to spread the wealth as far as we can.
Summit County Health Commissioner Donna Skota says her staff will vaccinate about 1,600 teachers using vaccine drive-thrus. Other districts tell me they'll have Akron Children's Hospital or Discount Drug Mart come to vaccinate staff in their districts in designated buildings. It's been almost a year since some students have been in the classroom 5 days a week, if at all. And Brian Knight's Constellation School students are all trying to learn from home, running a marathon no one signed up for.
We're at mile 24 to 25, and we don't want to do something where we're going to trip and break the leg heading down the last mile.
In Cleveland, I'm Kevin Barry, News 5.